Have you been troubled with back pain that's been going on for quite some time and has failed other treatments? Maybe you've had a scan that's shown some degenerative disc disease and you're wondering as to whether lumbar disc replacement surgery might be an option. My name's Anthony Ghosh, I'm a consultant spinal neurosurgeon and director of the Spine MDT, and in this video I'm going to talk about lumbar disc replacement. I'm going to explain why I personally do not recommend it and my approach as an alternative. This video is specifically about the lumbar spine and not the cervical spine or cervical disc replacement, which I've talked about in a separate video, and I'll link that below. Degenerative disc disease is a very common finding, even in people who do not suffer with back pain, so we have to be very careful in how we interpret it. Here we have an MRI scan of the spine showing the bones of the spine here, and in between the bones these bright things called discs, which are little cushions that act as shock absorbers. Wear and tear in the discs are quite a normal finding, but sometimes we get these inflammatory changes in the bone adjacent to the disc, and these can be the generators of back pain. The history and clinical examination are vital, but also additional tests such as a SPECT CT shown here can also show us if those areas on the MRI scan are indeed a pain generator. If more conservative treatment options have failed, for example physiotherapy or pain management, then an operation traditionally used for this is fusion surgery. So shown here is an anterior lumbar interbody fusion, where we've come in through the front of the spine, put in this breeze block here with some screws to fuse the segment, realign it properly, prevent any abnormal movement, and that has proven to actually help reduce pain. I've done a separate video on this procedure itself linked below. You can achieve the same thing by coming in through the back of the spine, where we remove the facet joint, put in the same type of breeze block but a bit smaller with some bone graft, but also stabilize the segment with a construct of screws and rods, and that's called a transforaminal lumbar interbody fusion that can be done through a minimally invasive technique. One of the criticisms of this procedure historically is that if you prevent all motion at this segment, the segment above or below has to make up for that, and therefore you can generate adjacent level disease, i.e. degenerative disc disease at this level and similar problems at this level, which may require surgery in the future. So why not fix this problem by replacing the disc with a device as shown here that sits in the disc base, and again this is inserted from the front of the spine. You're preserving these facet joints at the back and also preserving motion. Sounds like a great idea, doesn't it? Because replacing the disc preserves motion, it became a very popular option quite a few years ago, but over the years that option has declined significantly, with very few surgeons doing it, and this paper here has demonstrated that. And it probably highlights the problem with spinal research. A lot of publications that support a specific procedure are usually a series of cases of that procedure where overall the results have been relatively good with few complications. There are very few studies that compare one operation with another to give you a more definitive or robust answer. And often, if there has been numerous complications from an operation, people don't tend to publish that. It's not that they're hiding their bad results, they are obviously declared, but they don't go publishing them in a research article. One of the problems is that whilst we may have identified this region here adjacent to the disc being the generator of the pain, often simultaneously there is wear and tear of this segment of the spine as well, called the facet joint, which also generates some of the pain and gets overlooked. Therefore, when you preserve motion of this segment, whilst you might be eliminating some of the driving forces of the pain here, you still have movement in this facet joint that can generate pain, and it's very difficult to replicate the body's natural movement of that joint. And the trouble with this operation is that many patients thereafter still had ongoing back pain. Fuse the segment as shown here, we're eliminating motion altogether of this segment and the facet joint, therefore reducing the chance of ongoing pain provided we've got the diagnosis correct. So in my practice I prefer fusing the spine, but it's all about careful planning. You have to get the exact right size of disc in the disc space to generate the right height and therefore the correct alignment. but also involve your team. So, for example, the physiotherapists and exercises they can teach you to help prevent further wear and tear and therefore not get adjacent segment disease that's symptomatic. And if we incorporate all of this together with the right lifestyle changes, you can actually get really good results that last. There are now more novel devices being developed. As shown here is a total lumbar joint replacement where you come in through the back of the spine here as demonstrated, removing the facet joints on both sides, removing the disc, and instead of a cage being placed such as in the lumbar fusion, this disc replacement device is placed with this metal bit poking out here that rests and gets fixed into this bone here. Therefore, you preserve motion of this segment, but the facet joint is taken away so that can't generate any pain with that motion. Small scale trial comparing this method to the standard fusion approach I described has shown promising results, but this is with a very small number of patients. The development of new devices that can really help people with back pain is really exciting. But before I'm ready to use this in my practice, I want to see more robust data, a larger randomized controlled trial. I really hope you found this video helpful. If so, please click that like button and do subscribe to the channel. Also visit us at spinemdt.com to see how we can help you. Thank you very much for watching.